everyone, welcome to 5 Minute Video Study for the NCE. Today we are under clinical focus and we are going to be talking about heading AQ, which is child developmental issues. So this is certainly a big subcategory. When we talk about developmental issues, part of it is usually noticed in school. Many times it's noticed by the parents. So there's a lot of different dynamics that are happening where it could be some sort of a delay, some sort of a behavior that is being observed, and the adult is trying to figure out, what is the reason, what is causing it. Is there something more going on that I'm not seeing? Because again, children, infants, their verbal skills are not fully developed yet, so they have to rely on other forms of feedback in order to understand what is happening. So development is the notion of looking at a child's specific time period, and then looking at specific areas, and those areas could be things like the child's cognition, the child's motor skills, their ability to communicate, their social emotional skills, how well they're regulating, as well as their behaviors. And again, a lot of times, um, the, um, the first time children attend school, that's when they start to notice a lot of these behaviors because if they're at home, they're not interacting with other children around their age. Once all these areas are taken into consideration, then the child's behaviors and their development, that's where we can kind of look at, is it a developmental delay, or is it within the normal, let's say, one standard deviation of what is considered normal. In mental health, emotions or feelings are driven by behaviors, and a lot of times those emotions and feelings, if they're negative, then that reflects the behavior. So this is very much true in children because one, they don't have the coping mechanisms of an adult, but two, they don't have the verbal language that an adult has, right? As an adult, I can say, well, right now I'm frustrated. Can you just give me 5 minutes for myself to cool down? And then I'll be happy to, talk with you or to see if I'm regulating better. A child does not have the verbal language, the vocabulary to say that. So one of the key factors is that for parents especially, the behavior varies, and many times a parent would say, oh well, they don't do that at home. Well, that certainly can be true, but part of understanding developmental issues is understanding their environments, right? And understanding that if they're in a social setting with other groups of children, that provides a different stimulation of environment than maybe if they're by themselves, or if they're watching cartoons, because the technology provides a lot of different stimulation than you would expect in a kinder classroom, for example. Um, Also, it's important when we're talking about developmental issues. It's important to look at what is appropriate, and what is considered a normal or within one standard deviations of the mean. And with that, then we can look at, what are we observing. So a lot of mental health clinicians, that's kind of how they base some of their, whether it's a classroom observation or whether it's an observation at home, they're looking for those types of behaviors. Also, the environment can certainly play a role, right? If the child has been through traumatic experiences, that have been through changes, that have been through divorce, then that certainly might trigger emotion or developmental issues. Abuse, that's a big trigger that can, be caused by the environment. And then, with developmental issues, then there could be, developmental or mental health disorders. Just for example, obsessive compulsion disorder, chronic anxiety, or attention hyperactivity disorder. A lot of those disorders, are kind of related to some of the developmental issues. So those are just some things to keep in mind, and those are just some things to consider when talking about child's developmental issues.